Hi guys, how are you? Welcome back to a day in the life of a medical administrative assistant. Today I have a very good video you guys like my content, you've been saying my information is informative. So this video is going to be 10 things you do not want to do when you are a new medical administrative assistant. I want to say, guys, keep asking me questions. There's no question that is silly. Please don't feel shy. I'm here to help. It doesn't matter. Just keep asking me questions. And some of you guys have been doing that. Some of you guys have been following me, which makes me very excited. It makes me feel like this content is needed. And I will keep on producing more videos. If you guys have maybe a particular topic and as a medical administrative assistant you would like me to do, please put them below so that way I could come out with some content for you. Today we're going to talk about 10 things you do not want to do when you are a new medical administrative assistant. Now, I will be referring to my laptop because I did take some notes. I just want to make sure I go over everything. And I will also put some images because I know sometimes with me, I'm a visual learner, and I know sometimes people, when they see things, it actually is more visual. So I will be putting out some images on some tips that I'll be talking about. The number one thing you do not want to do when you are a new medical administrative assistant, you don't want to ignore patient privacy. Patient privacy is a big one in the medical field. Now, if you guys have been following the news or social media or TikTok, you know that there are some nurses, some providers, even some people in administration are losing their jobs because they're violating patient privacy. The most thing you do not want to do, and this is very bad, you do not want to post any type of images of your job. Now, in my videos, the first day, I showed you guys an empty office. There was nothing in there. Now that I'm settled in, I have patient information on my desk, all the stuff. I cannot show you guys what my office looks like because if I do that, I put that content out there, it could be like a HIPAA violation. It could be a violation towards a patient or something like that. Other thing people been doing too is and some nurses are posting pictures of them with patients, and then they're talking about these patients. There's been so many cases, guys. All I'm going to say this. Think about if you work in the medical field, think you are like a CIA. Have you guys ever seen a CIA on social media talk about their job? Have you ever seen an FBI agent talk about their job? No, because it's confidential. Think that way and you won't get in trouble. The only thing I would say is okay for you to post is a picture of maybe just yourself with no information in the back, okay? Take my advice, do not do it. Make sure it's a plain wall, and there's nothing there. So no one could come back and say, hey, I saw my mom's name or my dad's name. You don't want that type of sauce, so stay away from it, okay? The second thing you don't want to do is you do not want to neglect professionalism. Now, neglecting professionalism, and here's some example. You don't want to come across as being someone that is combative. You don't want to come across as being someone that's condescending. And that could go both ways. It could go either when you're talking with your peers, which are your coworkers, or maybe the doctor that you work for, or even patients. Because guys, understand this, you set the tone. You might work with a provider who is maybe, they might come across as a mean person, but maybe that's just their personality, right? Because understand this, they have a hard position. They're dealing with people every single day, and they have a lot of regulations that they have to follow. So it's a very stressful job for them. So, this will take practice, guys, because let me tell you, I started in this job at 2008. When I started, I'll be honest with you guys, I was very immature. I was very I was a little bit combative. I wasn't rude, but like if a patient or if a coworker or if a manager or a doctor would maybe give me sort of an attitude, I would take it the wrong way. And you have to have tough skin when you work in this field. You're going to have coworkers who are going to test you. You might have a medical staff member who is going to also test you. Guys, understand this. The best thing you could do is ignore them. Who cares what they think about you? Do not take it personal. Do not get into arguments with people at work. The best thing you could do is avoid it, but understand this. Always defend yourself in a professional way. Never defend yourself in aggressive mannerism, because that's not going to work good for you, or it's not going to work good for you when you go to the HR. So always come out being professional, okay? The third thing you don't want to do is you don't want to fail communication. This is a big one when you're a medical administrative assistant. There's going to be a lot of tasks. Now, this position, it could vary from department, it could vary from establishment. The best thing you could do is make sure when you're being asked to do something that's in your job scope, make sure you ask for clarification. Never assume anything if you're unclear, because unclear is uncertainty, and uncertainty could get you in trouble, and you don't want that, right? So if you're a doctor, or maybe the nurse you work for, or even a boss, because sometimes as this role, you could work for a financial officer, you could work for a CFO, you could work for a Present Hospital, you could do a lot of things in this type of position. So depending on what you need to do, make sure you always get clarity. Never just go ahead that you know what they're saying, or they think you understand. I am the first one to tell my doctor that I work for, listen, I don't know what to do. Could you please give me some more clarification? If I'm working on a prior authorization and then the rep is giving me some information that is going in one ear out the other, I need more clarification. And what I like to do to cover my ass, I like to repeat what I'm going to do. This way, there's no gray and white. We're both on the same page. Even though they know what's expected, I'm still going to tell them task 1, 2, 3, 4. I cover my ass. That way my ass is covered, and guess what? It's in writing. Never ever take any type of clarification word of mouth. Word of mouth could change from now till tomorrow. On email, it doesn't change. Whatever that provider told you, or whoever you're working with, whatever they type down in that document, you have that as proof. You don't have word of mouth as proof, because they could say, I never said that, or you misunderstood. You have no proof, right? So make sure you're communicating effectively in your responses. Make sure if there's a task that's asked of you, guys, please ask questions. The only dumb question is when you don't ask any questions. So anyone who does not ask any questions, does not struggle, there's something wrong. They're not doing what they're supposed to do, because you can't work at any job and not ask questions. That's just unheard of. Okay. The fourth thing you don't want to do is you don't want to avoid new skills. And I see this for a lot of people, right? A lot of times, some people will get very complacent in a job. Guys, you never want to get complacent in one job, because what happens is that you rely on that whole company, right? And you don't learn new skill sets. You don't market yourself. You don't know what's out there. I like to always give 1 to 3 years for any job that I work at, right? That's how I am. If I'm in a job and it's been 3 years, there's been no promotion, there's been no opportunities to take on more tasks, there's been no improvement, nothing, no new skill set, guys, I'm out of here, okay? And that's not a bad thing. That's a good thing, because what that teaches you, it's going to give you a lot of skill sets, and you're not just going to settle for a job. Now, as I get older, now I'm pushing 41, right? So as I get older, then I might stay in a job a little bit longer because of retirement, of health insurance, all that stuff. But when I was in my 20s, guys, it would be 1 to 3 years. And it was a lot of medical jobs. And I will go over them one day with you guys. but I just want to keep myself marketable. I never want to get comfortable in one job. A lot of times you get comfortable in one job, especially in this type of field. A lot of times jobs will take advantage of that. They don't, sometimes they'd be like, oh, well, she's been here for 20 years. She's happy with this position. We're just going to leave her at that position. No, guys, that's not good. That's why I say if you have this job, have another backup plan. Always have plan B. If plan A doesn't work, you can fall on plan B. For example, with me, I have my medical administrative assistant job. That's my 9 to 5. I come home, I make YouTube videos. I sell stuff on eBay, on Poshmark. I also sell Barbie dolls on Whatnot. I'm always learning new set. And eventually, I'm even thinking about learning how to do stock bonds, right? So these are all new things I want to learn. I don't want to live this life with just getting by, right? I want jobs where I could feel mentally challenged. I want jobs that offer me new opportunity, more growth, so I could expand myself. Okay, guys? Have you guys ever noticed celebrities, right? Like, for example, let's talk about Kim Kardashian, right? She is an entrepreneur mogul. She did not just settle for keeping up with the Kardashians. She does multiple things, multiple brands, multiple business. That's how these people are able to stay wealthy. If she just stayed in that one, I'm sure the show is paying her a lot of money, right? But if she just stayed in that one little show, and that show ended up getting canceled, but because she was so marketable and kept keeping herself in the spotlight, another company, I think it was Hulu that picked them up, and then they have it on the show. Guys, think of yourself as a celebrity. Think of yourself as being marketable. Don't just settle for the first job that lands on your feet. Look out there. Look at what the rate is. What's the highest you could get for your skill set? What other stuff can you do besides the main job that you have? That way, guys, you are happy, you're not burned out, and you are giving yourself more growth, more income. Okay? Is you do not want to overlook detailed documentation. Now, we talked about this at number 4, cover your ass. Now, detailed documentation could be multiple things. You want to make, so for example, for me, I work in pulmonary, so my provider always expects for me to collect CT scans, to maybe have patients do some type of procedure tests and things like that. So when those scan comes in or those procedures are done, I go in the patient's chart and I document receive CT scan on this date, receive documentation, receive procedures on this date. I put all that in the patient's medical chart. So when the day comes that the doctor has to see the patient, they're like, well, where's the CD? Where's this? Where's that? It's all documented in the chart. Now, not looking at detailed. So that could be documenting. That could be information that's coming in from a patient or from another facility. Not overlooking these things. Maybe your provider, every single department you work at, like if I worked at orthopedics, I worked at general medicine, now I'm working in pulmonary. Orthopedics and pulmonary, they always need a CT scan or an x-ray or something like that. You had to have that. General medicine was more of the medical records, right? So if I have these details, information, that stuff could get me in trouble because that means I'm not really paying attention to what is expected of me or what is in my job description. Number 1, the other one is, number 6 is you do not want to disagree with policies. Now, every single department, hospital is going to have policies. Now, there's going to be some type of protocol in each department. You don't want to avoid these because they could be protocols for new patients, for return patients. For example, where I work, if we have a patient that is calling, this is just general, that is having a hard time breathing, or maybe they're coughing out blood, or maybe they're very weak, those calls need to be triaged by a nurse. That is their office policy. When I used to work internal medicine, any call that patient didn't feel well, headaches, or maybe chest pain, not seeing well, those calls were also triaged to our nurses station. Now, if, for example, if I said a patient had a hard time breathing, hasn't been able to breathe very well in the last 2 days, and I saw an opening from my doctor, let's say my doctor had an opening in 5 weeks, I book a patient who could possibly have, these are some things that they could have, embolism. They could possibly have some type of tumor that's developing in their chest. They could have COPD. They could have a whole bunch of stuff. All I did was I took it upon myself to book this patient for 5 weeks. That is a big no-no. That alone could get you fired. And the reason why it's going to get you fired, because that patient could be, probably by the time they have their appointment, they could be gone, right? There could be something medically wrong. And guys, there is a whole bunch of liability. So please follow office policies. Every office policy is going to be different depending where you work, what hospital, and things like that, okay? Number 7 is you want to be able to take criticism very well. So critique criticism, right? If your manager is coming to you, or maybe the doctor you work for, or a nurse, they want to give you some criticism back. So they basically want to give you some improvement. Guys, take it professionally. Do not take it personally. Do not feel like you're being attacked. Understand this. Your boss is there to manage the office. Your boss is not your friend, okay? I know for some people it's kind of hard. Your boss has a job. Her or his job is to make sure that you're doing your job, you're following office policies, they can rely on you, you're there on time. Now, if there is some type of discrepancy or if there's a problem between you and your provider, it is that your provider will have their own boss and your boss will be your boss. It is their role to figure out what they could do to either help the situation, which is you who has the problem, to make it better for you and the provider. So it could be something like maybe you don't take messages correctly. Maybe you're sending things to the wrong, like we talked when we work in a hospital. So hospitals will have something called pool, and a pool is basically taking an email and you're forwarding it to either A, B, or C. Now, if you use Epic, Epic is a general system that most hospitals use. They're going to have pools where they could go to the nurse or directly to your doctor. Whatever that office policy is, that's where you're going to have to take some of these calls or messages. Now, if you're not doing that correctly, that could be a way for you to get criticized, showing up to work late, maybe you're very combative. These are all things that your boss needs to talk to you about, because that is his and her job to manage you as the employee, okay? Number 8 is you don't want to engage in gossip. This is a tough one for some people. For me, I don't care what people do at work. It does not affect me. Because here's the thing. When I get paid, I only see my name on the check. My check is not split with any other coworker. So if a coworker comes in late, doesn't want to do their work, want to walk the halls or surf the internet, that has nothing to do with me. But some people like to gossip. Some people like to tattle. I don't know. I don't know why. If guys, please type this below. I don't know why some workers feel like they need to tattle on the other worker. I work in a great office environment where none of us really care what the other one does. We do not gossip about each other. We don't get each other in trouble. We don't say anything because we're so focused on our job. And that's very rare that you're going to come across a good group of people. I've worked in environments before that are toxic, and I will do a video about that. I work in environments that are very toxic, very negative. Guys, understand this. No matter where you work, be the light. Be the one that sets the tone. Be the one you walk in the office, everybody wants to be around you because you are positive, you're happy, you like to help, you're caring, you're empathetic for others. People like to surround themselves with people who make them feel good. Don't be the grumpy one that walks in, oh, here comes Pierre, better watch out for her. She has a lot of attitude. You don't want to be that person. You don't want to be the one that's always talking about what A is doing. Focus on you. Stay in your lane. Only worry about you because let me tell you something. No matter what you do at work, someone's always watching. Okay? The person you think that is throwing you under the bus, that's not the person. It's always someone that you would never suspect. Okay? Understand that, guys. All right? So, and the other thing too is most hospitals, all calls are traced. Everything you do on the line. Now, if you're a manager, you better hope to God you don't get a micromanager. Because if you get a micromanager that likes to micromanage everything, and I had many of those. The one I have right now, I could not ask for a better manager. I really couldn't. I'm so comfortable with this manager. Because I do live shows for Barbie dolls. I was talking to her about it like earlier today. I might even have her come to one of my live shows. That says a lot about a boss, okay? She's not micromanaged. But if you have a micromanaged manager and you're someone who likes to surf the internet, they could pull up a report and see what you're doing, at what time, and why your work wasn't done. Be careful, guys. Be careful out there of where you work. Make sure that you are not talking about other people and focus on yourself, okay? Another thing you don't want to do is delay responsibility to patients' needs. So if your doctor is telling you, for example, I want you to book the CT scan stat. Now, stat means immediately, and it could be a possibility. Maybe they found something, something's developing, something is mastitized, something is growing, and they want that CT scan stat so that way they could try to maybe treat whatever it is or stop it from spreading. If your doctor told you they want the stat within a day, you did that after 8 days, guys, that is a huge problem. Not only are you neglecting the office policies, not only are you not doing your job, you're actually, hurting someone's health. That person is waiting for that CT scan to be booked, to be prioritized, all that stuff. And by you not doing it, you could actually make this person worse than what they are, guys. And that has happened a lot. It has. I'm not going to sit here and tell you it hasn't. Sometimes it happens by accident. Sometimes that's just how it is. It's something that I feel like as like a nation or as a group in healthcare, we have to do better, especially with U.S. healthcare, because I feel like other countries, they don't go to all these steps, but here it's like you have to have an office visit, and that could be months out. And then once that's done, you have to have it prioritized. That could be another 2 weeks. And then when you get that, you have to wait. So hopefully this will get better. But you know what? There's always room for improvement. But you could avoid all that tragedy just by staying on top of your job, staying on top of your emails. And if your doctor tells you to do something stat, guys, do it at instant. Don't put it off in the back burner. Work on it now. That's how I usually do it. Number 10 is assuming responsibility beyond your scope. So I'm a medical administrative assistant, right? So, for example, what will be beyond my scope is triaging calls. That is not my role. I don't have the clinical background. I'm not licensed. I should not be telling patients anything to do, even as simple as drinking water. I'm not supposed to say anything because you don't know what's wrong with that patient, okay? Another thing that would be going beyond my scope is reading maybe medical finding, telling the patient, oh, they found this in your CT scan. No. That is not your role. Not even a nurse would do that. That would come from a doctor. Because if a doctor gives a patient a diagnosis, that patient is going to have a lot of questions. And you need to make sure that that information is going to be some type of plan, a workup plan to treat whatever the issue is. Now, there are going to be some instances, and please do not get scared, where your provider is going to tell you, okay, give this patient this result. Like my doctor will tell me, this is what I want you to say. I would read word to word exactly what the doctor says, and I would tell them, if you have any further questions or anything else, I'm going to transfer you over to a nurse. That came from my doctor. That's what I do. Guys, I really hope this video was informative. Like I said, I was reading my email to you guys because I did type up some notes. I will do my best to get some images that pertain to what we're talking about. But please, if you have any questions, please let me know. Send them below. And guys, don't forget to like that button. And just before I end the video, I want to say this, guys. Understand this. There's a lot of negativity going around. But guys, understand you set the tone, okay? Be the light that people want to be. When I'm a woman of faith and I'm always trying to be positive, I'm always trying to make my coworkers laugh. You know, I'm a clown. I like to make people laugh. That's what I like to do. And people like that. Like, if I'm having a bad day or if I'm not getting something, I make a joke out of it. You know, I tell my coworker, oh, I got myself stuck in a black hole again. You know, and she just goes ballistic when I say things like that. Have fun and talk with people, engage with people, have rapport. Now, I know I said this many times, your coworkers aren't your friend. Establish a friendship. Sometimes, guys, you can make really good, lifelong friends at work, but it's just like dating. You need to establish a friendship. You got to establish trust. Do you guys have the same interests? That's how you establish a friendship. All right, guys, I hope to see you next time. My next video is going to be your coworkers aren't your friends. And I'm going to tell you guys some story of why coworkers aren't your friends and what have happened to me. I will see you guys next time. Please don't forget to always smile and be the light. Bye-bye, guys.